Hey, John Gentry here in Denver, Colorado. Wanted to catch up with all my friends and relatives out there. Being a week out, it's just time flies, and there's a lot of pain and recuperation. But to catch up on a double hip resurface, it's called a Birmingham hip resurface compared to a hip replacement. Hip resurface more invasive than a hip replacement because with a hip replacement you have your femur with the ball. They cut off that ball, the whole thing. They slam down into the femur a rod and then screw on a ball and usually porcelain, and then they have this other component in the socket and it fits together nicely, but then they have to put that all back together. With a Birmingham hip resurface, they take that bone out. Now they work on it nicely. They start shaving it. They take off what we call these. These are osteophytes. This is what it was in my bone, and this is a real one. I had the doctor go ahead and sneak a few out and hand it to Lori right after surgery. But this is the problem. This was what was going on. That right there is a bone spur. That was in my hip. That's where you get some bone to bone, so your body starts sending out notifications that it needs to repair itself, so it builds more bone, and now you got more bone to bone, and then all of a sudden that's why you get debilitating arthritis and cannot walk, and you have all those pain all over the place. Usually if you have shoulder pain or back pain or knee pain, it originates in the hips, whether you believe it or not. That's what I've learned. If I would have known what was going on 10 years ago, I could have delayed this. Maybe I wouldn't have done the full Ironman type training and as many marathons as I did. But with my genetics, there's a way they could have done some type of operation to move my hips and shave some bone here and there. Maybe I wouldn't even ever run into this type of situation where I have a double Birmingham hip replacement. And this is what I have. This is 12 weeks out on the left, and this one was done just last week. So again, trying to catch up with my friends and relatives that have been wondering how I'm doing. Been kind of quiet out there. Just really studying, I'm in the Word, just trying to keep my head straight and meditating. Trying to do the exercise that I can. But in the meantime, I never really stopped working. I'm what they call a remote employee, so I can work from home, but I still need to go out, meet and greet my clients. But I can also work from the phone. But it's mental, and with the pain, you got to watch, pain medication, not overdoing it, and also getting the rest so that we heal properly, because I don't want to have to go back and have some type of revision done. All right, so we've had the hip replacements done. My hips are totally replaced. Take a look at the scar. Not too shabby. This is the one from a couple, about 11 weeks ago. And then just a week ago, I just took this bandage off. As a matter of fact, took my first shower without the bandage on, and there it is. That's just a week ago. My legs have lost about 3 or 4 inches since all this went down 6 months ago, and time to rebuild that and get my strength and muscle back. My muscle tone is pretty weak right now. Upper body, I have been trying to work on my upper body, but it's been hard with just the pain of the arthritis. It's just it all comes together, and you just look for solutions. So the solution for me was the double hip replacement or resurface. And when you go through this, I was just going to give you a couple examples because I know there's some people out there that are thinking about going through the same thing and what's it going to be like. Well, there's some pain, but if you do things right and you train for your surgery like you train for your races, everything's going to be fine, and you're going to come back strong and even better. Why not? This is called a hip kit, $30. They give you at the hospital, and the occupational therapists and physical therapists come in and show you how to use it, so you can get around at home and dress yourself without everybody trying to help you, on your second, third day out. So I'm a week out right now, and I was going to give you a quick example. This picks up things, because you're dropping things forever. Your pen or pencil is kind of a pain because you can't bend over 90 degrees. So I'm picking things up with this. But also, it helps you with your pants, because right now, a matter of fact, I'm already doing this wrong. When you put on your pants here, I have this hip is good enough to go over 90 degrees now. But the right hip, there's no way I can bend down to get my pant leg in. So I just use this my hip kit gadget here and throw on my pants. Just got to be careful not to go pigeon-toed, cross your legs, or go 90 degrees. That's your that's what you can't do when you do a what we call posterior, coming from the side to the rear from behind and replacing the hips, because now they have a new way of going anterior, which they spread the muscle, and I'm hearing recuperation's a lot better, but I really can't do it with a Birmingham because there's not enough space. My doctor suggested and had the most experience with a Birmingham from posterior. So I do have those restrictions for 6 weeks that I can't go over 90 degrees. So we'll go ahead and put the left foot in and get our pants on. Now the main thing, how are we going to do socks and shoes? Well, that's why we have this little sock piece here where I can take my sock and roll my sock on this little device, and I can slip my foot right in. Okay, you just throw it out in front of you. You tuck your foot inside and swing it back, and voila, my sock is on. Okay, and now I'm getting to the point where I can just reach right there, pull it up tight, and I'm good enough now. This is why they don't want you to do a double at the same time. Usually it's a 3-month out type process if you're going to have a double hip replacement or a resurface. But I wanted it done as soon as possible, so I was about 2 months out. I had my second one done. But so I got some pretty good movement on the left side, and did my first walk the day before yesterday, 1/8 of a mile, and I was with the family yesterday, so I did some walking downtown. But as far as the shoes, again, I'm good enough on the 11-week or 12-week-old hip, looking good. I can slip that on, get my shoe on there, and then with the other side, we'll use part of one of the gadgets in the hip kit that we can just go ahead and slip our foot in the shoe, and let's see how quickly we can get this on. That's fine. There we go. And that shoe is on. There you go. All right. I wear my shoes like I wear them in marathons. In my races, I leave them real not too tight, and that's the way I like to roll, especially when you're doing triathlons, because you don't want to sit there tying shoes when you're trying to do personal records and racing the whole 9 yards. But there you have it. The bone spur again. Here's our problem: is our own body fighting itself because we have some bone-to-bone happening. The cartilage is worn out, so you start developing these guys, and this guy will be, I'm just going to have this one resurfaced myself with maybe a 14 karat and put a little hole in it, and it kind of looks like a shark tooth, but to remind me what can happen out there if if you're in athletics. I'm telling you from the beginning, I got a 9-year-old. I'm going to be keep an eye on your joints. Keep an eye on your joints, because you know what? Oh, you're not always going to feel it. It's like cholesterol. You don't feel cholesterol. You don't feel your veins corroding and being full of debris in there and having hardening of the arteries until you have the heart attack. Well, that's kind of what happened with me. This osteoarthritis, it just creeped up on me, and boom, man, it went to town. So John Gentry here in Denver, Colorado. God bless you, and we'll see you at the top.